Hey everyone! Welcome to a deep dive exploring medications that target your gastrointestinal system.
That's right.
You're prepping for a nursing pharmacology exam and
We're here to help you conquer those GI meds.
antacids,
Proton pump inhibitors.
H2 receptor antagonists,
We'll break them all down,
into easy-to-remember pieces,
explaining how they work.
and share practical nursing tips along the way.
We'll uncover the why behind each medication's action.
And
Even sprinkle in some interesting tidbits to help it all stick.
joining us is a pharmacology expert who can shed light on these medications and their role in patient care.
Happy to be here.
Let's get started with those familiar friends antacids.
Okay.
I know I've reached for them more than a few times after a spicy meal.
Sure.
They're like the first responders for heartburn,
Yeah,
neutralizing that excess acid and bringing much-needed relief.
exactly.
Antacids work by directly neutralizing the acid already in your stomach.
Kind of like a chemistry experiment happening right in your gut.
Oh, wow.
Think of it as pouring baking soda on a vinegar spill.
Yeah.
It neutralizes the acid, creating a more balanced environment in the stomach.
Cool.
But they do more than just neutralize.
Oh,
Antacids also help stimulate the production of protective mucus and bicarbonate in the stomach,
interesting.
creating a barrier against the harsh acid.
So it's a double whammy.
Yes.
Neutralizing and protecting. But I've noticed there's so many different kinds of antacids on the shelves.
Right.
What's the difference?
Right.
And how do I know which one to recommend to a patient?
There are four main types:
Okay.
aluminum,
Uh-huh.
magnesium,
Okay.
calcium,
Okay.
and sodium bicarbonate.
Okay.
Each has its own characteristics and considerations.
Interesting.
For instance, aluminum compounds are often recommended for patients with kidney disease because they're easier for the body to eliminate,
Makes sense.
but they might cause constipation.
That makes sense.
You wouldn't want to give someone with kidney problems a medication that's hard for their body to process.
Okay.
Now, if you need quick relief, magnesium compounds are great because they work fast and have a high acid neutralizing capacity.
Oh, cool.
However, keep in mind that they can lead to diarrhea.
So it's all about finding the right balance for each patient.
Precisely.
Okay.
Then we have calcium carbonate antacids,
Okay.
which not only provide quick relief, but also offer an extra boost of calcium.
Nice.
However, be aware that they can cause constipation
Okay.
and sometimes even lead to rebound hyperacidity if stopped abruptly.
Interesting. It's like the stomach gets used to the lower acid levels and overcompensates when you stop the antacids?
Exactly.
Wow.
Lastly, we have sodium bicarbonate,
Okay.
the main ingredient in Alka-Seltzer,
Uh-huh.
which is highly soluble and works rapidly.
That's good.
However, its effects are short-lived,
Yeah.
and its high sodium content makes it unsuitable for patients with heart failure, hypertension, or kidney problems.
So choosing the right antacid is like a puzzle.
Yes,
Considering the patient's individual needs and potential side effects.
absolutely. And remember, antacids are meant for short-term relief.
Makes sense.
If someone is relying on them constantly, it's a sign to investigate further
Uh-huh.
and see if there's an underlying issue that needs to be addressed.
Good point.
We don't want to mask a bigger problem.
We don't want to do that.
Now let's move on to the traffic cops of acid production,
Okay.
the H2 receptor antagonists,
Uh-huh.
or H2RAs.
Okay.
These medications work a bit differently than antacids.
Oh, okay. So instead of neutralizing existing acid H2RAs, reduce acid production by blocking histamine receptors in the stomach lining.
That's right.
Okay.
These receptors are responsible for triggering the release of stomach acid.
Got it.
Some common names in this class are cimetidine,
Okay.
famotidine,
Okay.
and ranitidine.
Okay.
While generally safe,
Mm-hmm.
H2RAs can cause side effects,
Okay.
particularly in older adults with liver or kidney issues.
So if antacids are like mopping up a spill, H2RAs are like turning off the faucet.
Precisely.
I like that.
And here's a practical tip for nurses.
Okay. What is it?
If a patient is taking both H2RAs and antacids,
Okay.
advise them to take the H2RA about an hour before the antacid.
Oh, why is the timing so important?
Well, the H2RA needs time to work its magic
Okay.
and reduce acid production.
Okay.
Antacids can actually interfere with its absorption if taken too close together.
Interesting.
Taking them separately ensures optimal effectiveness for both medications.
That's really helpful to know. It's all about those little details that make a big difference in patient care.
Yes, definitely.
Now let's talk about the heavy hitters in acid control proton pump inhibitors, or PPIs.
Okay.
These are like the powerhouses in the world of GI meds, right?
They are indeed.
Okay.
PPIs provide longer lasting relief compared to antacids or H2RAs.
Oh, wow.
They work by binding to the proton pump
Okay.
The very enzyme responsible for pumping those little hydrogen ions, protons, into the stomach,
Okay.
effectively shutting down acid production at its source.
So they're like the ultimate acid blockers.
Exactly. PPIs are the go-to treatment for conditions like GARD,
Okay.
erosive esophagitis,
Uh-huh.
and peptic ulcers.
Okay.
Let me explain those a bit more.
Sure.
So you are comfortable explaining these conditions to your patients.
Okay.
GRD, also known as heartburn or acid reflux,
Right.
happens when stomach acid flows back up into the esophagus,
Uh-huh.
causing irritation and discomfort.
Right.
Erosive esophagitis is a more severe form of GRD,
Okay.
where the acid reflux actually damages the lining of the esophagus.
Oh, wow.
Peptic ulcers are sores that develop in the lining of the stomach,
Uh-huh.
or the first part of the small intestine,
Got it.
often caused by that pesky bacteria called H. pylori,
Okay.
or by long-term use of certain medications like NSAIDs.
Wow, thanks for clarifying those conditions.
Sure.
It's important to understand the why behind the medications we're giving, not just the names and mechanisms.
Absolutely. Now, back to PPIs, they can also be used in combination with antibiotics to combat those H. pylori infections we were just talking about.
So they're multitaskers too. But I've heard that PPIs, while very effective,
Yes.
might come with some long-term risks.
That's an important consideration.
Okay.
While PPIs are generally safe for short-term use, long-term use has been associated with an increased risk of certain issues,
Like what?
like bone fractures,
Oh, wow.
low magnesium levels,
Okay.
and potentially even a slightly higher risk of gastric cancer.
It's a reminder that all medications, even those that bring relief,
Yes.
have potential risks and benefits to consider.
Exactly.
Okay.
Let's talk about a few specific PPIs that you'll encounter in clinical practice.
Sure.
Pantoprazole, for instance, is unique because it's the only PPI available for intravenous administration.
Oh, okay.
This makes it a valuable option for patients who are unable to take oral medications.
That's a good one to remember.
Another one to keep in mind is lansoprazole.
Okay.
It's the only PPI that can be opened and mixed with juice or soft food,
Nice.
which is really helpful for patients who have difficulty swallowing pills.
That's a great tip. Making sure patients can actually take their medication comfortably is key.
Absolutely.
Now, since we're talking about individual needs, let's shift gears and discuss lifespan considerations when it comes to these acid-controlling medications.
Sure.
I imagine that dosage and potential side effects might vary depending on the patient's age.
You're right.
Okay.
For example, older adults typically require smaller doses of acid-controlling medications because their bodies naturally produce less stomach acid as they age.
That makes sense.
We don't want to overdo it,
Right.
and because older adults often have other health conditions and are taking multiple medications,
Right.
it's especially crucial to monitor them closely for potential side effects and drug interactions.
It's all about that personalized approach, considering each patient's unique circumstances.
Yes.
What about infants? Are there any specific acid-controlling medications used for them?
Yes, there is one that comes to mind, simethicone.
Okay.
It's a safe and effective option for reducing gas and discomfort in babies. It's available over the counter and doesn't have any listed adverse effects.
That's great to know. Relieving those tummy troubles in little ones is so important.
It is.
Now that we've covered the main players in acid control, let's talk about nursing considerations.
Sure.
What are some key things to keep in mind when caring for patients taking these medications?
Well, first and foremost, a thorough assessment is essential.
Okay.
We need to know about the patient's allergies, medical history, current medications, and any potential contraindications.
Okay.
It's like gathering all the puzzle pieces before you can start putting them together.
So it's like being a detective gathering all the clues to ensure we're making the best decisions for our patients.
Exactly.
I like that.
We also need to monitor patients closely
Okay.
for both therapeutic effects,
Okay.
meaning their symptoms are improving, and for any adverse effects that might pop up.
And of course, patient education is crucial.
Absolutely.
We want to make sure our patients understand how to take their medications correctly, what side effects to watch out for, and when to seek medical attention.
Empowering patients to be active participants in their healthcare is so important.
Now, before we move on to the world of antiemetics, which tackle nausea and vomiting,
Okay.
let's quickly recap what we've learned about these acid-controlling medications.
Right.
It feels like we've covered a lot of ground.
We have. We started with antacids, those fast-acting acid neutralizers,
Right.
then explored H2RAs,
Okay.
which work by blocking histamine receptors to reduce acid production.
Right.
And finally, we delved into the potent world of PPIs, which directly inhibit the proton pump to shut down acid production at its source.
And we've highlighted key nursing considerations along the way,
Yeah.
emphasizing the importance of thorough assessment, careful monitoring,
Right.
and comprehensive patient education.
That's right.
Now, are you ready to explore the world of antiemetics?
Let's do it.
Okay.
Well, from heartburn to ulcers, we've tackled those troublesome acid issues.
Yeah.
But now let's turn our attention to another common complaint:
Okay.
nausea and vomiting.
I think we've all been there.
Right.
That feeling can really knock you off your feet,
Absolutely.
whether it's from motion sickness,
Well,
a stomach bug,
yeah,
or even those tough side effects of chemotherapy.
absolutely. And thankfully,
Yeah.
we have a whole arsenal of medications to combat that queasiness.
Oh, good.
Antiemetics.
Okay.
These medications target different parts of the brain and body
Oh.
involved in the vomiting reflex,
Okay.
providing that much needed relief.
So they're like calming that internal storm that's brewing.
Precisely.
Okay.
Some antiemetics work by targeting the vomiting center and chemoreceptor trigger zone in the brain,
Okay.
while others focus their efforts directly on the gastrointestinal tract.
So it's like having multiple strategies
Yeah.
to tackle the problem.
Exactly.
Okay, let's break down these different antiemetic classes.
Okay.
Starting with anticholinergics.
Okay.
I remember learning about scopolamine, which is often used for motion sickness.
Yes, scopolamine is a classic for motion sickness.
Right.
It works by blocking acetylcholine,
Okay.
a neurotransmitter that plays a key role in that nausea-inducing pathway.
Got it.
By blocking those signals,
Okay.
scopolamine helps prevent those feelings of nausea from reaching the brain.
Interesting.
Think of it as intercepting that vomit message before it reaches its destination.
So it's like a roadblock for those nausea signals.
Right.
But like any medication, I imagine there are potential side effects to consider.
That's right.
Okay.
Scopolamine can cause drowsiness,
Okay.
blurred vision,
Uh-huh.
rapid heartbeat,
Okay.
and dry mouth.
Okay.
It's also important to note that it's not suitable for people with glaucoma.
Good point.
Yes,
It's all about weighing the benefits and risks for each patient.
absolutely.
Now, what about antihistamines?
Okay,
I know some of them can also help with nausea.
absolutely. Dimenhydrinate, better known as gravel,
Uh-huh.
and diphenhydramine,
Yeah.
the active ingredient in Benadryl, are both effective for motion sickness and nausea related to allergies.
Okay.
They work similarly to scopolamine
Okay.
by blocking those pesky acetylcholine signals.
So these medications are like the multitaskers of the pharmacy world,
Yes,
tackling allergies and nausea in one go.
that's right.
Are there any specific patient populations we should be cautious with when using antihistamines?
Yes. It's always wise to use them with caution in older adults and children,
Okay.
as they can be more sensitive to their side effects.
Good reminder. Now, shifting gears a bit, what about those powerful antiemetics used for chemotherapy-induced nausea and vomiting?
Right.
Those must be so crucial for patients going through such a difficult treatment.
Absolutely. We call these medications serotonin blockers.
Okay.
They work by blocking serotonin receptors,
Okay.
which play a significant role in those nausea and vomiting pathways,
Okay.
especially those triggered by chemotherapy.
So they're like a protective shield guarding against those overwhelming waves of nausea.
Exactly. Medications like dolestron,
Uh-huh.
polonosetron,
Okay.
granisetron,
Uh-huh.
and ondansetron,
Ah.
better known as Zofran,
Yeah, I've heard of that one.
are the stars of this class.
Okay.
They are often given before chemotherapy
Mm-hmm.
to help prevent those debilitating bouts of nausea and vomiting.
Zofran is a name I hear all the time working in the hospital.
Yeah, it's common.
It seems like it's become the go-to antiemetic for many patients.
It's definitely very effective,
That's good.
but just like any powerful medication,
Yeah.
it's important to remember that even serotonin blockers can have side effects.
Like what?
Headache,
Okay.
constipation,
Uh-huh.
diarrhea,
Okay.
and in rare cases,
Yeah.
a heart rhythm problem called QT prolongation are potential concerns.
Oh, wow.
Yes. So it's important to monitor for those.
It sounds like close monitoring is key,
Yes,
especially since these patients are often taking multiple medications.
absolutely.
Now let's talk about antidopaminergic drugs. I know they're used for various conditions,
Yes.
but how do they fit into the antiemetic picture?
Antidopaminergic drugs like chlorpromazine and prochlorperazine
Okay.
work by blocking dopamine receptors in a specific part of the brain,
Where?
the chemoreceptor trigger zone,
Okay.
which is involved in that vomiting reflex.
So they're like the gatekeepers
Yes.
preventing those nausea signals from getting through?
Exactly.
Okay.
However, these medications can cause a range of side effects,
Oh, no.
some of which can affect movement,
Like what?
like tremors
Oh, wow.
and muscle stiffness.
Okay.
And in rare instances,
Uh-huh.
they can lead to a serious condition called neuroleptic malignant syndrome,
Oh, gosh.
which requires immediate medical attention.
That sounds pretty scary.
Yes, it can be serious.
It's a reminder that even medications meant to help can sometimes have serious consequences.
Right.
It's all about carefully weighing those benefits and risks.
You're absolutely right.
Okay.
Now let's shift gears and discuss prokinetic drugs.
All right.
They have a unique mechanism of action,
Oh.
tackling nausea and vomiting from a couple of different angles.
Okay, I'm intrigued. Tell me more about how these prokinetic drugs work.
Well, they not only block dopamine in the chemoreceptor trigger zone,
Okay.
like the antidopaminergic drugs we just talked about,
Right.
but they also speed up gastric emptying.
Oh, wow.
Basically, they help food move through the digestive tract more quickly.
So it's like a two-pronged attack, both calming those nausea signals in the brain
Yes.
and getting things moving more efficiently in the gut.
Exactly.
What are some common examples of prokinetic drugs that I might encounter?
Two you'll likely see are metoclopramide,
Okay.
sold under the brand names Maxaran and Metonia,
Okay.
and domperidone,
Uh-huh.
also known as Motilium.
Got it.
They're often used for nausea and vomiting,
Okay.
related to conditions like gastroparesis,
Okay.
where the stomach muscles aren't contracting normally to move food along.
Ah, that makes sense. If the stomach is emptying slowly, it's more likely to cause those feelings of nausea and discomfort.
Precisely.
Okay.
However, it's important to be aware that long-term use of metoclopramide
Uh-huh.
can potentially lead to a movement disorder called tardive dyskinesia,
Oh my God.
which can be irreversible.
Wow, that's serious. It's another reminder that even with medications designed to help, we need to be mindful of potential long-term effects.
Absolutely.
Now, I've heard that even marijuana can be used as an antiemetic,
Really?
particularly for those tough cases of chemo-induced nausea and vomiting.
Okay.
Is there any truth to that?
Yes, there is.
Okay.
Tetrahydrocannabinols, or THC for short,
Uh-huh.
which is the psychoactive component of marijuana,
Right.
can indeed have antiemetic effects.
Okay.
There are a couple of medications containing THC, dronabinol, and nabilone
Uh-huh.
that are approved for treating nausea and vomiting related to chemotherapy.
So it's not just about the high associated with marijuana,
Right.
but about harnessing its medicinal properties.
Exactly.
Okay.
But of course, we need to remember that THC
Uh-huh.
can also cause those expected side effects,
Like what?
like drowsiness,
Okay.
dizziness,
Uh-huh.
and that euphoric feeling.
So it's about finding that right balance between benefits and potential side effects, as with any medication.
Absolutely.
What about morning sickness during pregnancy?
Okay.
Are there specific antiemetics that are considered safe and effective for that?
Yes. There is a common combination of doxylamine succinate,
Uh-huh.
which is an antihistamine,
Okay.
and paradoxin hydrochloride,
Okay.
better known as vitamin B6.
Yeah.
That is often used to treat morning sickness.
Okay.
It's sold under the brand name Declectin.
That's good to know. So many women struggle with morning sickness,
It do.
and having a safe and effective option is so important.
You're absolutely right.
But it's crucial to note that Declectin does have some contraindications,
It does.
meaning certain individuals shouldn't take it. For example, people with asthma,
Okay.
narrow-angle glaucoma, peptic ulcer disease,
Okay.
or those taking certain medications like MAOIs should avoid it.
Right.
And of course, alcohol is a definite no-no when taking Declectin.
Exactly. It's really important to avoid alcohol with many of these medications.
Always important to follow those guidelines and consult with a healthcare provider to ensure it's the right fit.
Yes, definitely.
Now, I'm curious about natural remedies.
Okay.
Are there any herbal options for tackling nausea and vomiting?
There is one that comes to mind that has been used for centuries.
What is it?
Ginger.
Oh, yeah.
It's a popular natural remedy for nausea and vomiting,
Yeah.
whether it's morning sickness,
Mhm.
motion sickness,
Right.
or even that chemo-induced nausea we talked about earlier.
I love ginger. I always have ginger ale on hand when I'm feeling a bit queasy.
It can be quite effective.
That's great.
However, it's important to keep in mind that ginger can interact with other medications,
Oh, really?
like blood thinners. It's always wise to check with a healthcare provider before using any herbal remedies,
Good advice.
especially if someone is taking other medications.
So we've explored a wide range of antiemetics.
Yes, we have.
From those that target the brain to those that focus on the gut. From pharmaceuticals to natural remedies.
Right.
Now let's put on our nursing hats and talk about the key considerations when caring for patients taking these medications.
Well, just as with those acid-controlling medications we discussed earlier,
Uh-huh.
a thorough assessment is paramount.
Okay.
We need to gather a comprehensive history,
Right.
including any underlying conditions,
Okay.
current medications,
Uh-huh.
and potential contraindications.
So it's like being a detective, piecing together all the clues to ensure we're choosing the right antiemetic for each individual patient.
Precisely.
Like that analogy.
We also need to closely monitor for both therapeutic effects,
Okay.
meaning that nausea and vomiting are subsiding,
Uh-huh.
and for any potential side effects that might arise.
And, of course, we can't forget about the importance of patient education.
Absolutely.
Making sure our patients understand how to take their medications correctly,
Yeah.
what side effects to watch out for,
Uh-huh.
and when to seek medical attention can make a world of difference.
Empowering patients to be active participants in their healthcare journey is so important.
Okay, let's take a moment to review what we've covered about these diverse antiemetics.
Okay.
Before we move on to the final stretch of our GI deep dive,
Right.
we've explored so many options.
We discussed anticholinergics,
Mhm.
antihistamines,
Right.
antidopaminergics,
Okay.
prokinetic drugs,
Uh-huh.
serotonin blockers,
Right.
tetrahydrocannabinols,
Okay.
the combination of doxylamine succinate and pyridoxine hydrochloride for morning sickness,
Uh-huh.
and even that natural remedy ginger.
Each class targets a different aspect of that complex vomiting reflex, whether it's blocking acetylcholine,
Uh-huh.
dopamine,
Right.
or serotonin receptors, or speeding up gastric emptying.
Right.
It's like a multifaceted approach to calming that internal storm.
Exactly.
And as we've emphasized throughout our discussion,
Yeah.
nursing considerations are crucial when it comes to any of these medications.
Oh.
Thorough assessment, careful monitoring,
Yeah.
and comprehensive patient education are the cornerstones of safe and effective care.
Well said.
Yeah.
Now, are you ready to tackle the final leg of our GI journey?
Let's do it. All right, we've covered a lot of ground from antacids and H2RAs to PPIs and a whole arsenal of antiemetics.
Yeah.
Feeling like GI masters yet.
We've definitely explored the key players. But remember, our goal is to help you feel confident and prepared for that nursing pharmacology exam.
Right.
So let's put all this knowledge into action.
Okay, how do we do that?
And think about how you as a nurse would apply the nursing process to those patients who are dealing with acid-related issues or those dreaded bouts of nausea and vomiting.
Love it.
Let's dive into the nursing process.
Okay.
Starting with that all-important assessment phase.
Okay.
What are the crucial things you'd want to assess in a patient experiencing those GI troubles?
Oh, first and foremost, we need to understand the patient's story.
Absolutely.
What are their specific symptoms?
Right.
How long have they been experiencing them? What makes them better or worse?
Yeah, all important questions.
Gathering these details helps us paint a clearer picture of what might be going on
Right.
and guides our treatment approach.
Exactly.
So it's like detective work gathering all those clues to figure out the mystery.
I like that analogy.
We also need to delve into their medical history.
Yes. Very important.
Do they have any underlying conditions like kidney or liver disease?
Right.
Are they pregnant or breastfeeding?
All things to consider.
These factors play a significant role in determining which medications are safe and appropriate.
Exactly.
And of course, we can't forget about allergies and current medications.
Oh, for sure.
Those drug interactions can be tricky and potentially dangerous.
Absolutely.
It's like a delicate balancing act.
Yeah.
Making sure all those medications are working together harmoniously.
Very important.
And we also need to consider lifestyle factors like smoking and alcohol use,
Right.
as these can influence how effective those treatments will be.
Absolutely.
So assessment is all about gathering as much information as possible
Yes.
to create a complete picture of the patient's needs and potential risks.
That's right.
Once we have that foundation, we can move on to those nursing diagnoses.
Right. Based on our assessment findings,
Okay.
we can develop nursing diagnoses
Uh-huh.
that target those specific problems
Okay.
and guide our interventions.
For example, if someone is experiencing persistent vomiting,
Yes.
we might identify a nursing diagnosis like risk for deficient fluid volume,
Absolutely.
or imbalanced nutrition, less than body requirements.
Those are great examples.
That makes perfect sense.
Yeah.
We're identifying those potential complications that could arise from their condition and the medications they're taking.
Exactly.
Okay.
And then comes the planning stage, where we set goals
Uh-huh.
and map out that course of action to help our patient achieve those goals.
Okay.
We work collaboratively with the patient, their family, and the rest of the healthcare team to develop a plan that truly addresses their individual needs and preferences.
So it's a team effort, everyone working together to support the patient.
Absolutely.
I like it.
And then comes the implementation phase,
Okay,
putting that plan into action.
that's the big word.
This is where we administer medications as prescribed,
Okay.
being very careful to monitor for both the desired therapeutic effects
Yeah.
and any adverse reactions.
Right. And throughout this whole process, we're constantly evaluating,
Yes.
making sure our interventions are truly effective, and tweaking that plan as needed, right?
Right.
Okay.
It's a continuous cycle of assessing, planning, implementing, and evaluating.
Got it.
We're always striving to provide the best possible care for our patients.
That was a fantastic breakdown of the nursing process applied to these GI medications.
Glad it was helpful.
I feel like I have a much clearer understanding of how it all fits together.
Awesome. Remember, as a nurse, you're not just administering medications.
Right.
You're using your knowledge and critical thinking skills to ensure those medications are used safely and effectively to improve your patients' lives.
Well said.
Thank you.
A huge thank you to our pharmacology expert for guiding us through this fascinating world of GI medications.
You're very welcome. It was my pleasure.
And to you, our listener, best of luck on that nursing pharmacology exam.
Yes, good luck.
Remember, you've got this.
You've gained a wealth of knowledge.
That's right.
Now go out there and rock that exam.
Keep diving deep, keep learning, and keep those questions coming.
Until next time.
Until next time, stay curious.